Australians, unfortunately, are world record holders when it comes to gambling. We bet more than any other country in the world. We lose $25 billion per year on gambling in Australia. We also lose the most money to online gambling per capita of any country in the world. We lose the most to online gambling per capita of any country in the world. So this inquiry was about looking at, are our current regulations fit for purpose? Are we doing enough to stop harm before it starts? Are we doing enough to help people who are experiencing harm from gambling? Given that there are 31 recommendations in this report, I think it's fair to say that the answer is no, not anymore. Regulations aren't fit for purpose anymore, and there is much more we could do. One of the motivations for this inquiry, for this committee asking Minister Rishworth to refer us this inquiry, was that all of us on the committee, Liberal, National, Independent and Labor, hear from our communities over and over again that parents are worried about their children's exposure to advertising for online betting. That children as young as 7 and 9 are starting to talk about sport essentially as a vehicle for betting. They talk about the odds. They can identify gambling companies by their colours and their logos. They don't talk about who their favourite player is or how skillful their favourite player is or whether their team's going to win. They talk about the odds. And parents don't like that. They don't like that. We also, as members of parliament, hear over and over again stories of people with lived experience of gambling harm. Like Jesse from my community in Frankston, who contacted me because of this inquiry, who's an excellent young man, 27 years old, played for Langy Football Club, is an occupational therapist, but struggled for almost a decade with terrible losses from online gambling that he didn't feel he could tell anyone about because he was ashamed. And he lied to his family and his friends, and he lost more money than he could afford, and he lost relationships because he couldn't stop gambling. And because every time he tried to stop gambling, he was contacted by a gambling company that offered him inducements to come back, that called him and said, here's some tickets to a sporting event. Come with us, have free food, have free alcohol, and gamble more. Jesse asked me to do what I can to stop other people from falling into that same cycle that he was in and that he is now very much looking at the end of, and I promised him that I would. I want to thank everyone who gave evidence to this inquiry about their personal experiences. You can't overestimate how hard it is for people to publicly talk about some of the hardest times in their life, some of the worst things that have ever happened to them, and to do so not because they want to make things better for themselves, but because they want to stop it happening to other people. The people who gave evidence to this inquiry were courageous and they were strong, and I know the other members of the committee join me with paying tribute to them for what they've done. I want to thank the other members of the committee. 31 recommendations, over 150 submissions, I think some 18 or so days of public hearings, and across the political spectrum we got a unanimous report. People don't see often enough that sort of work happen in federal politics, and I think it's important that we acknowledge how hard every member of the committee worked and put aside politics to say we need to make recommendations that will make Australia better for the next generation. And I also want to take this opportunity, they'll be embarrassed by this, but to thank the committee secretariat, without whom we could not have run this inquiry or had such a thorough report. There are a lot of recommendations, 31 of them, and a lot of attention is being paid today, rightly so, by our recommendation that over the course of 3 years, all advertising for online gambling be banned. A comprehensive, staged, considered, thorough approach to protecting children from seeing advertising for betting while they're watching television, while they're watching Bluey on YouTube, while they're on social media, from preventing people who are experiencing gambling harm from being targeted with advertising on social media, on the news and during news breaks, on the television and on the radio, and from freeing up Australians from being bombarded with gambling advertising. But there's a lot of more recommendations in this that are really important. A national harm reduction strategy for online gambling. At the heart of it, a public health approach to take away that stigma that people like Jessie felt that meant that they couldn't reach out for help at the early stages of their problem. A national regulator to try to mean that the states and the territories and the federal government can work together to properly regulate online gambling. A levy placed on online gambling providers to go to harm reduction. A national ombudsman, so people have one place they can go to complain about rules and regulations not being followed. A ban on inducements. More support for research. More support for social supports, counselling for the people that need it who are experiencing harm. And we recommend that the reforms the government has introduced to deal with loot boxes and simulated gambling in online gaming be supported, be reviewed, and that more be done for consumer protection so that parents know what their children are being exposed to when they're online gambling. So as I said, I'm very proud to be part of a committee that's worked together to bring this report down. I'm very much looking forward to the next 6 to 12 months to see where the recommendations go, and I'm very happy to answer any questions that anyone might have.
Thank you for that. Just wondering, do you think the government will implement these recommendations in full?
Well, to be fair to the government, they got the report when everyone else did this morning at 7:30, and there's 31 recommendations. So there's a lot to work through. I'm confident we've given them a lot to get on with. I'm confident from what the ministers have said over the last few months that they're very much looking forward to these recommendations and working their way through them. So I'm positive that we will see a very strong response from the government. They understand, I know, that Australians want to see some change.
These recommendations are similar to what Peter Dutton was calling for in his budget reply speech, along with crossbench support. Are you confident they'll be adopted quickly and without much pushback?
Well, Peter Dutton did make an announcement in his budget reply speech about further restricting when advertising can be played during live sport. What I would say, though, is that these recommendations go much further because they are comprehensive. We haven't cherry-picked one reform here or there that is easy. We've said, let's do the easy reforms first, but then work our way to making sure that end goal of the harder reforms, banning all advertising, a real national strategy, a real national regulator, are also implemented. So I feel confident that there will be support across the Parliament for these sort of comprehensive, staged recommendations that we've put forward, some of which can happen immediately, some of which will require more work, more negotiation, more consultation with sports bookmakers, sporting bodies, broadcasters, and importantly, public health experts and people with lived experience.
So was there bipartisan support for the recommendations from the committee?
From the committee, there absolutely was. So our committee is made up of Labor, Liberal, National Party and independent members of the committee, and I'm really pleased to say, a unanimous report that everyone signed up to.
What would be an acceptable timeline for these changes to happen?
Well, in terms of the advertising ban, we've suggested 3 years. Now, that might be the appropriate timeline. We think that would give long enough for some of the arrangements to be put in place that need to be, as I said, for some of the tougher reforms, as well as doing some of the, I say easier, none of these reforms are easier, but slightly easier reforms. For example, a ban on online advertising to be immediate, whereas a phased-in winding down of advertising on broadcast television and radio, for example. And there are, of the 31 recommendations, there are a number that could be implemented almost straight away. There's others that will require much more legislative thought, and will require cooperation from the states and territories. We can't get a national regulator, we can't get a national ombudsman unless the states and territories agree to be part of it. And I think that's a significant piece of work that really I'm hoping the states and territories put their hand up to be part of.
You said you want a health-centred approach to tackle gambling addiction, harm and stigma. Is the health system equipped for this?
Well, it doesn't have to be necessarily entirely in the health system. It's a very good question. A public health approach really is a way of taking responsibility away solely from the individual. Of course, people have responsibility for their own actions, but as with alcohol and drugs and tobacco, we also understand that there's addictive qualities, and it's not always an individual's responsibility, which also helps to deal with that stigma and shame, and say it's actually a public health responsibility. Taking a public health approach is also saying there's not one silver bullet that will deal with the harms or the potential harms, which is why we've set a national strategy with public health approach at the heart of it, and underneath it lies 30-odd different recommendations, ranging from advertising through to more coordination of gambling-specific counselling, for example.
There might be some pushback from industry. How do you intend to combat some of that pushback?
So certainly we heard from industry during the inquiry. We were very anxious to ensure that we heard from broadcasters, from sporting groups and from bet makers how they feel that this would impact them. It's partly why we've recommended a comprehensive staged approach to give time to deal with some of the consequences. Of course, if you can't advertise, it does have a consequence on advertising revenue. But as a committee, we were also confident that, as happened when tobacco advertising was banned and tobacco sponsorship of sport was banned, it can be done, other sources of revenue can be found, and that in the end, when you have to choose between the harms that Australians experience from a product or an industry and the income or reliance on that income of broadcasters and sporting organisations, that we think that broadcasters and sporting organisations will see the public good of dealing with the harms.
Can you say a bit about the importance of the national ombudsman and how that might improve with some of these points?
So we heard that people find it difficult to know where to go to make a complaint if they think that there's been advertising that breaches the current rules, for example, either the content of the advertising or the time that it's on, or they feel that the online bookmaker that they use hasn't paid out a bet when they should have, or has contacted them when they shouldn't have. Where do you go to make that complaint? Whilst there are some industry-run complaint bodies and some independent government-funded bodies, it's hard to find the right one. We felt that a national ombudsman sitting under the regulator would essentially be able to be a one-stop shop, so that anyone who has an issue knows where to go and it can be dealt with. And if it's a serious issue, obviously can be escalated to the regulator for an inquiry and to be dealt with as a breach of laws.
What was the process like to get to these 31 recommendations? Were there any more recommendations that you were wanting to get through?
Oh, look, it was a very long process. As I said, we had many days of public hearings. We had many submissions. What we did was really consider hard the evidence and which of the suggested recommendations were supported by the evidence we heard and by the research. And when it came down to it, these 31 recommendations, I think I can say on behalf of the other committee members, were very easy for us all to agree to.
And just lastly, what do you think it will mean to the person like you spoke about earlier, making these recommendations and getting them through? How will that change people's lives individually?
I know it means a lot to Jesse. I talked to him yesterday afternoon. He came into my office for another chat, and he feels like he's been heard. He feels like the really difficult circumstances that he's been through perhaps now will be able to be used to help other people not to have to go through it. And I know that the members of my community who I've talked to about this report coming out soon have said, we are just so pleased that the Parliament is acting on something that concerns us. That as members of the community, we feel like you have all gone to Canberra and said, this is what our constituents care about and we want to do something about it. So I think it will make a big difference to their lives.